I'm Paul Thorley, Clinical Director of Elite Physical Medicine. We are a private sports injuries and physiotherapy clinic. My background is I'm an ex-physical training instructor and rehabilitation officer. I left to do my undergraduate physiotherapy degree, and since then I've worked in Olympic sport and elite sport for the last 15 years. I'm also a lecturer and senior fellow at UCL, teaching on a sports medicine master's degree. Although I teach sports medicine and look after elite athletes, we treat every patient as if they're an elite athlete, irrespective of whether they are an elite athlete. And I believe that all patients should receive the gold standard of care, irrespective of their long-term goals, whether that be gardening or running an Ironman triathlon. The clinic is both friendly and professional, with experienced physiotherapists and sports injuries doctors. We have a well-equipped rehabilitation gym that provides an environment for people to work post-operatively or any injuries they've got. We also facilitate them coming back to use this in their own time. This, we find, increases compliancy to treatment and allows a speedier recovery back to activity. Within the gym, we've invested in some expensive pieces of equipment, one being Cybex iKinetics, which allows movement of a limb, measurement of range, and it's based upon resistance, which means that we can look for deficits in range of movement and in power. The other thing we have, which is a specialist piece of equipment, is Dartfish, which is a movement analysis system, which allows us to video, slow down and to tag different movements. This highlights any discrepancy in movement which may contribute to the injury. At that point, once we've worked out what their problem is, we can put in place a long-term strategy which allows them to correct the problem, thus requiring less treatment in the future. At Elite Physical Medicine, we are closely aligned and linked with specialist consultants in all areas. So, following on from the initial assessment, whether the patient needs a referral to a specialist or they receive in-house treatment within Elite Physical Medicine, we treat them in the same way, with the same protocols we would treat our own family. As a clinic, we look after and have special links with Sports Relief. So last year I did the £1 million bike ride with David Williams. The year before I looked after Girls Aloud and they climbed Kilimanjaro. We have close links with Darren Goff, the local cricketer, who does lots for charity, and we're involved in some sponsorship around this area as well. The future plans at Elite Physical Medicine are to create another physiotherapy clinic, still with the support of consultants, in the south of Buckinghamshire, around Amersham or Chalfont St Peter.